Ever wondered how Ozempic affects your face? Today, I'm going to explain how weight loss affects your face, and also I might debunk some of the myth around Ozempic Face and other related procedures. Let's get to the truth behind the headlines. Ozempic and Ozempic Face. What do we need to know, and what's all the buzz about? Ozempic is basically a semaglutide that was first done for diabetics. Because if you have excess weight, excess sugars, then you're more likely to get a stroke, have heart defects, all kinds of health problems. And one of the side effects that was noticed using it was people were losing weight. So of course it's fantastic for diabetes, but just like a lot of medicines that we've seen, side effects can turn around and be the main use. Let's talk about Botox as an example. Botox was used for muscle spasm. I tell the people that contract their face and used to go in the grocery store at 2 or 3 in the morning because they were embarrassed for people to see them twitching all the time. And as that was treated, they noticed no wrinkles. Then it was rebranded for that. Another popular one is Viagra. Viagra was made for hypertension. They were given that to the groups they were studying, and the people kept wanting more and more, and they finally asked them why, and to their delight, we know what happened. So let's get back to Ozempic. Ozempic can cause rapid weight loss. The key thing about weight loss is all the studies show you want to ideally lose about 1 pound a week. If you lose 2 pounds a week, that's really the maximum that you can do it in a healthy fashion. There's people using Ozempic that are losing 3 or 4 pounds a week. And so what happens is you have a lot of fat that's leaving an area that has high fat content, which is the face. So as we age, we normally have some displacement of fat and some movement. But if you accelerate that, basically what you're doing is you're aging your face to the benefit of losing weight. So Ozempic Face is basically giving people premature aging. It's affecting your face exactly as it would over time, but it's accelerating it. You're trading off the benefit of weight loss to your body, but you're suffering because your face can look worse. It can also affect people in their buttock region that have had fat injections. They're gonna lose fat there, and the Brazilian butt lift that they had is gonna be reduced. So let's get back to the face. So what do we do for that? Say you're losing weight, you're healthy, your doctor likes it, and everything's going good. Well, you can stay on Ozempic, but you just need to understand that we need to come up with a good plan for facial rejuvenation. So the main thing that happens with facial rejuvenation as we age is you get some deflation, you get some skin changes, you lose some volume, which is the fat from Ozempic, and your muscles will sag. So to undergo a surgical procedure to tighten all that, that's called a facelift, called a blepharoplasty, a brow lift. It just depends on what area of the face. When you think about the face, you should think about it in thirds. The upper third is really the forehead, brow area. The middle third is like the lower lid, cheek area. And the lower third is around your mouth and your jawline. And the neck goes over the jawline. Ozempic does affect fat in all those different zones. The main thing to keep in mind is you're doing something to lose weight and be healthier, but if you're not planning on having surgery or you think you would want to, you might be disappointed by the overall results that you're going to get in your face. Another thing to consider is if you do have deflation of some of the fat in your face, we can, to a certain extent, re-inject that. And what that means is we can take fat from your hips or your tummy and we can process it like we need to, and we can inject it to give you more cheek fullness, to help with some of the hollows where the buccal fat area is, to the side of the mouth, also the upper lids. A lot of times I'll have people that have been on some of these weight loss medications, and I'll take fat from one area and I'll inject it into their upper orbit and their upper lid, and I can restore their eyes that looks very natural and as good as a blepharoplasty. But the advantage is is you haven't removed any skin and there is no scar. So one of the things I always try to do with people, especially if they have a Ozempic type face that people are talking about, is do an inside out approach. The advantage of that is we're working at the deepest layer, which is the bone layer. And then from the bone, we're going more superficial to the skin. So the fat is moved with the muscle. So you get a better result and you also have no scars. So there's a lot of pros and cons. The good news about Ozempic is it's been around for years. It's gotten a lot of buzz in the last few months, especially with some of the celebrities. And even Oprah herself has admitted to using some of these medications. So I think that it's going to be here to stay. The side effects are very manageable, but the one side effect that you're not going to just manage is the Ozempic face, because if you want to change that, you're going to need to have surgery. So think about all that when you decide, is it worth it? And so I think that it's a myth that Ozempic causes it, but you do have significant changes in your face because of fat loss. And if you deflate that balloon, just like you look at the rubber on a balloon, it's not going to be the same when you blow it up again. So you need to have fat in your face. I call fat in the face God's gold. I like to say, keep your natural gold in the face so that you look very young and youthful. That's the giveaway for people when they start to lose a lot of fat. Think about the trade-off, but I think Ozempic is an outstanding drug for the right person, but it's not the kind of drug you want to take if you want to lose 5, 10, 15 pounds for a high school reunion or a wedding. It's something where you need to have significant weight loss and you need to have what's called a comorbidity, like hypertension, diabetes, something like that. So get out there, don't be afraid of Ozempic, and if you do get Ozempic face, you know where to go.